In today's module, we will focus on various behaviors in children. What are the criteria for diagnosing ODD? You must look at the emotional and behavioral symptoms: angry and irritable mood, frequently touchy, easily annoyed, often loses temper, argumentative, often blames others for his or her mistakes, often argues with adults or others in authority, often deliberately annoys or upset people. The mental health professional will complete a comprehensive psychological evaluation in order to determine whether your child has ODD, because ODD often occurs along with other behavioral or mental health problems. The symptoms of ODD may be difficult to distinguish. Your child will more than likely have an assessment of the following: the frequency and intensity of behaviors, family situations, presence of other mental health, presence of other mental health, learning, or communication disorders, effective and ineffective strategies in managing problem behaviors, and the child's overall health. Other emotional and behavioral symptoms include if the child is vindictive or shown vindictive behavior. ODD can also vary in severity. It can be mild, moderate, or severe. There is no clear cause of oppositional defiant disorder. However, there are contributing causes that possibly may be a combination of inherited and environmental factors. They are as follows: genetics, the environment, parenting issues, temperament, and other family issues. What are the complications? ODD may lead to many other complications that include antisocial behavior, impulse control issues, suicide. Many children and teens with ODD may also have other mental health disorders, including ADHD, depression, conduct disorder, anxiety, learning and communication disorders. There is no guaranteed method to prevent ODD. However, treatment and positive parenting can improve the child's behavior, their self esteem, and restore positive relationships between the parents and the child. It may also include family based interventions, other types of psychotherapy, and training for the child. The treatment usually lasts several months or longer. The cornerstones of treatment for ODD include the following: individual and family therapy, parent child interaction therapy, parent training, cognitive problem solving training, and social skills training. During parent child interaction therapy, the therapist will coach the parents as they interact with their child. In one approach, the therapist sits behind a one way mirror and uses an earbud audio device that guides the parents through strategies that reinforce their child's positive behavior. As a result, parents learn more effective parenting techniques. The quality of the parent child relationship improves, and problem behaviors decrease. There's also cognitive problem solving training, and it's aimed at assisting children in identifying and changing their thought patterns that lead to behavior problems. Collaborative problem solving, in which the children and the family members work together to solve problems and to develop solutions that work for all parties. And this could also help improve ODD related problems. There's also social skills training. Children may also benefit from therapy that will help him or her to become more flexible and learn how to interact more positively and effectively with peers. Lifestyle remedies for parents and families. Families can chip away or deter problem behaviors of ODD disorder by practicing the following strategies: be prepared for challenges, work together, set up a routine, build in time together, recognize and praise, set limits, pick your battles. Before your appointment with the doctor, make sure you take information in regards to your child's signs and symptoms, your family's key information, your child's school performance, medical information, and medications. What are your questions for the doctor? What do you believe is causing my child's symptoms? Are there other possible causes? Should my child see a mental health professional? And how will you determine the diagnosis? What questions should you take to the mental health professional? Do you recommend family therapy? How can our family assist our child? Is my child at an increased risk for any long term complications from this condition? What treatment approach is recommended? Does my child have ODD or another mental health disorder? What factors contribute to my child's problem?
Like a written copy of this presentation, here is the URL. You can also go straight to our website, educationandbehavior.com, and at the top there's a search box. You can search for the article there, Top 10 Discipline Tips for Kids with Oppositional Defiant Disorder, or you can find it in a Google search. Raising or working with a child with oppositional defiant disorder can be extremely frustrating because you feel like everything is a constant battle. You just want your child to do his homework, pick up his toys, get dressed for school, and you're constantly faced with refusal. As a behavior specialist and school psychologist, I've had many parents and teachers ask for advice on how to handle this kind of defiant behavior. In my training, I learned a lot about positive behavior support strategies and have used them with my clients and students for the past 16 years, and now with my own son. I can tell you firsthand that these strategies are extremely effective. They work when I use them and when I teach others how to use them with their children or students. People often think that positive behavior support is simply giving rewards for good behavior, and when that doesn't work, they think that the system doesn't work. I have repeatedly heard that positive behavior support does not work from people who were not using it correctly. While a piece of positive behavior support is allowing children to earn privileges rather than taking them away, it is so much more than just that. It is a way of speaking, acting, and responding to behavior. Here I have summarized my top 10 tips. By the way, these tips are effective for all kids, not just those diagnosed with oppositional defiant disorder. Tip number 1, set up expectations ahead of time and allow your child to earn privileges for following those expectations. This is much more effective for encouraging compliance than punishing your child or taking away privileges when they don't do what you want them to do. Let your child have a say in what they want to work for. Allowing children to earn privileges puts the ball in their court. They know what is expected and they know what they have to do to earn the things they enjoy. They also feel a sense of pride when they earn what they worked for. When your child starts getting off track, remind him of what he is working towards rather than telling him what you will take away if he doesn't listen. A related article is 25 privileges you can let your child earn for good behavior. Here's the URL, or you can also search for it on educationandbehavior.com or on Google. Tip number 2, use transition warnings to let your child know what is coming next. Here's an example. In 10 minutes, it is time to turn off your video games and come eat dinner. Or after this show, it is time for homework. Give some more reminders as the time is winding down, like in 2 minutes, it's time for dinner. A timer or visual timer can be helpful for children who don't have a concept of time. You actually probably have a free visual timer app right on your tablet or smartphone. Just go to your app store and search Kids Visual Timer. Visual timers are also available on Amazon or other online stores. To learn more about visual timers and timer implementation, check out 3 ways to use timers to encourage homework and chore completion. And again, here's the URL. Search for it on the site or on Google. Tip number 3, use empathetic statements to show your child you understand how he feels. Imagine how you would feel if someone came into your room and said, "Get off the computer and go to bed." Although they are kids and are expected to follow adults' rules, they still have the same feelings you would have in that type of situation. You can show them you understand how they feel with a statement such as, "I know you're really enjoying your computer time and you don't want to turn it off, but you need to get rest for school tomorrow. You can have some time on the computer again tomorrow." Tip number 4, phrase directives in the positive and remove the word can. For example, instead of "stop jumping on the furniture" or "can you stop jumping on the furniture," try something like "sit down" or "come down off the couch" in a calm but confident tone. If possible, provide an alternative activity or redirect them to something they like to do, like "let's do jumping jacks together" or "here are some puzzles or blocks to play with." Children respond much better when you tell them what to do rather than what not to do. Anything you want your child to stop, you can phrase in the positive by giving them a clear direction of what you want them to do. Giving an explanation such as "you can fall" or "that can damage the couch" is often helpful as well. Tip number 5, use specific praise when your child follows your expectations or listens to your directions. Some examples include, "Excellent job picking up your toys," "You were so focused during your homework tonight," or "Nice job listening to directions." Specific praise or acknowledgement of healthy behaviors reminds the child of what behaviors you are looking for and reinforces them. Tip number 6, pick your battles. If your 5-year-old is playing in the dirt and you find it disgusting, let him. As long as he's safe, not hurting or disrespecting himself or anyone else, and not damaging anything, try to give him as much freedom as possible. Tip number 7, give your child choices whenever possible. Examples include, do you want to wear the green or red shirt? Do you want to do your math or reading homework first? Or do you want to set the table or take out the garbage? Tip number 8, say what you mean and mean what you say. If you tell your child that he needs to pick up his toys before he can play outside, make sure you follow through on your rule and honor your end of the bargain. Stay away from empty threats like punishments that you will never follow through on. Your child will come to learn the value of your words. If you don't mean what you say, he won't take you seriously. Tip number 9, if possible, utilize a schedule with your child that builds in chores, homework if applicable, self-help tasks like showering and brushing teeth, and fun activities. Have your child participate in creating the schedule. Embed the fun activities into the schedule so that your child alternates between preferred and non-preferred activities. One part of the schedule needs to be complete before moving on to the next part. Also keep in mind that children with idle time on their hands are looking for things to do. So structuring their time can alleviate some impulsive behaviors like running and jumping in the house. A related article is how to use schedules to improve children's behavior. Here's the URL. Again, you can search for it on the website or on Google. Tip number 10, avoid arguing, long lectures, or sarcastic remarks about your child's behavior. Stick to your rules and don't negotiate, go back and forth, or argue with your child. If your child starts to argue or tantrum after you have stated the rule and shown empathy, let him or her know that you are not going to discuss it anymore. Do not give attention to a temper tantrum.
On yesterday's podcast, we talked about ADHD and how children with ADHD, because of some of their impulsivity and some of their overactivity, they may become irritable or agitated as a flash in the pan, as something that happens sort of impulsively, but then it's gone and it disappears.
Right. What we're talking about generally, just by way of review, is the whole issue of kids who display flashes of emotion.
Right.
And it can be very quick, like with ADHD, or it can be a longer periods of emotional expression. Typically, we think of temper tantrums in very young children, emotional meltdowns in older children. Okay, and the question we want to talk about this week is, how do we know when we ought to be worried about it as a psychological condition, and when it's just sort of attention-getting behavior?
Right.
How do we make that separation? And the word we keep mentioning this week is intention. Okay, so on the one hand, you have what is the intention of the person. On the other hand, you have the whole the concept of intensity, duration, and frequency.
Right.
Okay, and you mentioned with ADHD, it's over in a hurry. You know, it comes, it appears, and there's a little flash, and it's over.
Right.
Okay? Where with other disorders, they persist. They become more persistent. Okay, so you have intensity, duration, and frequency. Okay, and then, but on the other hand, you have intentionality.
Right.
Okay, so those are the key words. Now, we talked about ADHD yesterday. Today, we're going to talk about one of our favorites. Oppositional defiant disorder. And there's a reason it's our favorite.
Well, it's it's our favorite in a paradoxical way, because it is actually one of our least favorite. Today with oppositional defiant disorder and tomorrow with conduct disorder, those two are among our least. Not that we have favorite disorders or anything like that, but they're the least informative.
They're the least informative. We get a little frustrated, and I don't like the word frustrated, when people make a diagnosis of oppositional defiant disorder, because every kid is oppositional and defiant at some point.
Right.
I mean, at least they try to be. And kids with ADHD have many of the same characteristics of kids with ODD. But there are some important distinctions.
Right.
It's just that as clinicians, I think it's incumbent upon us to differentiate these disorders more carefully, and not just say, well, he's oppositional. Of course he's oppositional. Of course he's defiant. That's why we're seeing him.
Right.
Okay. So it's not informative. It doesn't tell us anything.
Right. So we'll start with oppositional defiant disorder, and we'll get to conduct disorder tomorrow, because they are different. And if we think about sort of a spectrum, and this is a little bit dated because the DSM-5 doesn't work them the same way. Right. But there's a little bit of a spectrum where you start with oppositional defiant disorder, and if those symptoms worsen, then you get to conduct disorder, and if those symptoms worsen, then you get to antisocial personality disorder. But the DSM-5 kind of treats them a little bit differently. But oppositional defiant disorder is a condition or a set of behaviors, obviously characterized by oppositional behavior, defiant tendencies. These are circumstances where kids will, refuse to follow rules. They will, and we're using these words very specifically because kids with ADHD don't follow directions, but it's because they are inattentive and they're distractible and they're impulsive. Kids with oppositional defiant disorder don't follow rules because, again, by diagnostic criteria, they refuse to do so. That's
right. The difference, we say there's a lot of overlap, but here with ODD, we're talking about frequent and persistent. Okay, with ADHD, kids are ADHD in all settings, but here we're talking about three important characteristics that kind of differentiate kids with ODD from kids with ADHD. And they are that these kids are, first of all, they are argumentative. Right. Okay. The kids with ADHD typically don't argue with you. They're not defiant and argumentative.
If they do, it's, again, an impulsive thing that's based upon what is happening right now. Kids with oppositional defiant disorder will be argumentative, but it's again a sort of a more pervasive, and it's an obvious attempt to manipulate or to guide you in the direction that benefits them in some way.
And that's the intentionality that we were talking about, okay? Because they're argumentative because they don't want to take blame for anything.
Goal seeking.
They don't want to take the blame for anything that they do wrong. They become defiant, but again, they'll stand to, and kids with ADHD don't do that sort of stuff.
Right.
You know, they're
Not
just
typically,
there's
yeah.
different. Okay, so the first thing is these kids are argumentative, and that's one of the things the parents tell us is that, you know, he just wants to argue about everything, and he's defiant, and he blames others, he never takes responsibility. So that's the first characteristic. The second is they're angry. And again, this differentiates them from kids with ADHD because, as we said yesterday, kids with ADHD are usually fun to be with.
Right.
Okay, these kids are angry and irritable, and it's a pervasive anger. They're usually in a bad mood, unless they're tormenting somebody and they're getting some delight out of that. Okay,
Right, and those symptoms aren't, they're there, but they're not, when we talk about conduct disorder tomorrow, that sort of takes these to a different level. You know,
Right,
kids with conduct
that's
disorder are a little bit more destructive with this. So these kids may be angry, may be a little bit vindictive, but it's sort of the elementary school version of
That's right.
of that. You know, they
you're right. This is the crocus of the disruptive behaviors. Right.
Right.
It peaks out in the early spring. You know. But in smaller amounts.
Right.
You know, tomorrow we're going to talk about much bigger concerns,
Right.
much more significant concern with kids who have conduct disorder. Many children with oppositional disorder will let go of this as they mature and they grow
Right,
up and
most
their
do,
brain
right.
stabilizes. If they don't, it could proceed into and progress into conduct disorder.
Right.
So you're right; it's a lighter version of conduct, kind of the elementary school version.
Yeah.
You know, they're not there yet.
Right.
You know, and they could go either way. So that's another reason why we want to be careful.
Right.
You know, about making these diagnoses.
But again, the important thing that you mentioned is the fact that with oppositional defiant disorder, there is an intentionality
to it. Right.
So they are doing it with the purpose of gaining something or avoiding something.
Avoiding something. Right.
So, you know, while kids with ADHD do it impulsively because it you know meets an immediate need or is an immediate gratification, kids with oppositional defiant disorder are doing so with a goal, with a purpose.
That's right.
And that makes it quite different. From a diagnostic perspective, it's extremely difficult because who decides what's intentional or not?
That's right.
And that's
How
one
do
of the
you know?
reasons we dislike these diagnoses, because most of the time, intent is defined by the adult.
Right.
We don't know for certain that the intent is there, but it's implied by the child's behavior, but interpreted through the perception of the adult.
Right. And what if the intention is just to have fun, just to enjoy
Right.
yourself for a few minutes? Is that really so terribly wrong? You know.
Right.
So that's why you have to be careful. The third characteristic of these kids, the first was they're angry. The second is that they're argumentative. The third is they're vindictive.
Right.
And again, this differentiates them from other sorts of disorders. These are kids who get even. You know, they've been wronged, and so now they have to get even. So there's a little bit of spite in them. You know, you see this spitefulness.
Right.
But the nice thing, and they say, well, how do I know how many? DSM does us a nice service because they tell us at least twice in the last 6 months.
Right.
Okay. So
Again, it's a light version of it. I mean, it's not
Right.
like something that happens every day.
right.
You know.
Right. And so that's a nice metric sort of to use if you're looking for some numbers to say, well, how do I know? Well, one of the ways is if the child's been spiteful more than 2 times in 6 months.
Right.
That's not very much spite.
Right.
You know. But again, we're talking about serious spite. We're not talking about, you know, name
Right.
calling and that sort of thing. We're talking about really getting even.
Right. And just a quick example to differentiate this, and I'll probably use a very similar example tomorrow when we talk about oppositional or conduct disorder, is, you know, when you're looking at, as we said a moment ago, there's a lot of overlap between some of the symptoms of ADHD and some of the symptoms of oppositional defiant disorder. And really the difference in many ways is based upon the interpretation of the adult, right? So,
That's right.
you know, was it intentional or was it impulsive? But one way that we can look at some of those differences is through, you know, in examining the child's behavior. So let's take, for example, that a kid goes to school and another kid is picking on them or says something to them that really upsets them. The ADHD kid who, you know, may be prone towards anger may lash out and hit that kid right then.
Right.
You know, immediately it happens, there's no awareness of what's going on around it. You know, the principal could be standing right there, and the kid would still react physically and act out, or at least call names and, you know, verbally.
Yeah, but there wouldn't be planning and scheming and
Right.
a calculation of when I should do it and who's not looking.
Right.
They just forget and bang, it happens.
Right. The kid with oppositional defiant disorder and also conduct disorder, they're going to measure that and say, you know what, this isn't a good time.
Right. But I'm going to
wait until the opportunity is right, and they will sort of watch and plan and organize their behavior so that they can react at a time and in a place that benefits them to meet some needs. So it may be that they do it when there's no one else around, or they may do it when certain friends are around, so that, you know, it gains them some status or something like that. So the planning and, again, the intentionality of it is obvious based upon you know, the child's behavior.
And having said that, you can see why it's important to make these differential diagnoses very carefully, because each one would require a very different kind of intervention. You know, and because that's what we're getting to. The rubber meets the road at intervention.
Right.
And we want to make sure we have the right diagnosis so we can implement the correct interventions. And that's why we say to people, you know, we don't use the same intervention for everything. You know, don't just punish by taking their cell phones. You need a differential intervention for a differential diagnosis.
Absolutely. So, all right. So that is oppositional defiant disorder.
Right.
Tomorrow we'll talk about conduct disorder, which is just to continue our analogy, this is the high school version of these behaviors, and so we will tackle that beast tomorrow.
And
Of challenges. It's a time of irritability and easy frustration with adults. In this first scene, the physician adopts an authoritarian approach. Clara, you should turn that off. You shouldn't have that on in here. And take those earplugs out. I want to make sure you're listening to me when I'm talking.
Okay.
All right, well, how are things going for you?
Fine.
And how are things going with your mom? Look, don't fiddle with those. How is school going?
It's fine too.
Well, your mom says that your grades are low. Why do you think that is?
I don't know. Ask her.
Well, look, I'm just trying to help. And right now, I'm just really lecturing to you to kind of really bored and you just can't stand what I'm saying. It's really bad. In the next scene, the physician tries to deal with the situation by being more permissive. Hi, Clara. How are you doing?
Good.
And this is your time to bring up any problems you might have. Are you having any health issues, any aches or pains?
No, everything's fine.
Well, your mom brought up that school's not going so well.
Oh, I need to talk to this person. It will just take a second. Oh, hi. I'm at the doctor's office. But I can meet you later. You know that Pizza Hut on Meyer Street? Yeah, my mom said she can drop me off there. We should call April and ask if she can come.
Finally, we see what happens when the physician works to establish a relationship with the patient. Hi, Clara. What kind of music do you like?
Rap mostly.
Oh, my son likes that. Do you have a favorite artist?
Soulja Boy. He was in concert here last week.
Okay. Well, I'd like to talk to you for a few minutes before we do the physical, so I wonder if you'd turn that off and take your earplugs out. And could you mute your phone?
I'm expecting a friend to call.
Okay, well, you can call her back as soon as we're done talking. Okay, and how have things been going for you?
Pretty good.
Are you interested in those?
These things make your knees jump, right?
They do. We're going to use that later. If you want, I can explain how it works.
Okay, I like science.
Is that your favorite subject?
Kinda, but I failed my midterm exam though.
Oh, well, let's talk about that. What makes science hard?
Remembering everything about it.
Okay, and are you getting along with the teacher okay?
Yes.
Any big arguments with her or anything?
No, she's really nice.
Oppositional defiant disorder, or as some people know as ODD, occurs in about 20% of the school-age population and is definitely more commonly seen in boys than girls. Children with ODD usually are diagnosed by the age of 8 years old, and it's a consistent pattern of defying authority, being vengeful, seeking revenge, not following rules, and getting into trouble all of the time. I often consider that children who have these signs and symptoms of ODD, it's really secondary to a bigger problem: anxiety, depression, some type of school-related difficulty. When I see this pattern of behaviors and when it may be discussed with different parents, we're often looking for other underlying causes of the ODD. Because it is a series of negative behaviors, ODD can be treated with behavioral therapies and behavioral management. It's important for the parents to seek professional help so that they can learn some of the key factors to help manage the behavior. So while there are many other factors to consider with a child who's oppositional, these are some of the key points that parents should understand and recognize to help their children.